Before you become an ER nurse, you should have ICU experience. I know that sounds crazy because they're two completely different worlds. However, you'll understand where I'm coming from once I explain it. The ER is way too fast. You are not able, as a newer nurse or as someone who doesn't have critical care experience, to jump into the ER and easily pick it up. There's too many moving parts, too many patients coming in, patients going out, and you don't have enough time to really grasp why you're doing certain things before you're doing them. The ICU, on the other hand, has that ability for you to take a breath. Sometimes it's very busy, but most days, you and your two patients or one patient, you have time to think, right? You can think through, why am I doing this? Why am I giving this drip? Is this safe for this patient? In the ER, you don't always have time to do that. You have to be able to do it quickly. New ER nurses are able to do well in the ER. You don't have to have ICU experience, but I'm telling you, it'll make a massive difference in how you view the ER if you start first in a critical care unit where you can learn these critical care hard concepts and then reapply them to patients in a faster paced environment. Granted, I will say that if you're meant to be an ER nurse in your mind and you go to the ICU, it's going to be harder for you to really fit in there. I struggled a lot coming from EMS and wanting to be in the ER, going straight to the ICU. I really struggled with the culture because I wasn't that type A person. I'm more of a type B, let it flow, we'll figure it out as we go kind of guy. And I must admit, the ICU is not meant for that. But if you make the effort to try to do their ways and check the boxes, label all the lines, do all the things, you'll eventually come to realize that these things are important in the long run, even if you're not going to need to do them in the ER.